Hello everyone. In this video, we are going to discuss about frozen shoulder, which is also called as adhesive capsulitis. What is frozen shoulder? Frozen shoulder is the inflammation of the capsule around the shoulder joint. And because of this inflammation, patient will develop a lot of pain and stiffness and restriction of movement of the shoulder joint. Now, the aim of this video is not to provide you the information as to how we can treat it, but the aim of this video is to provide you the information as to how best we can treat it. What are the best options available so that you can get rid of this frozen shoulder? Now, what is the cause of frozen shoulder? The cause of frozen shoulder is not known. It is unknown. But there are some factors which are called as risk factors where the person can develop frozen shoulder. What are the risk factors? This frozen shoulder is most commonly seen among the diabetic patients, and also people who suffer with hypothyroidism can develop frozen shoulder, and also people with cardiovascular disease can develop frozen shoulder. Sometimes when there is trauma or surgery performed to the shoulder, then over a period of time the person can develop frozen shoulder. Not only that, whenever there is prolonged immobility of the shoulder joint because of any other reason, the person gets predisposed to developing frozen shoulder. Now, what are the symptoms of frozen shoulder? The symptoms of frozen shoulder are: number one, pain. There will be a lot of pain on the movement. If the person tries to move the shoulder, there will be a lot of pain in the shoulder, and there will be stiffness of the joint. The joint will not move freely, and there will be restriction of movement. The range of movements will be restricted. So there will be a lot of pain and stiffness and restricted mobility in the frozen shoulder. The person will not be able to lift the hand properly. They will not be able to move the hand forward or backward. So there will be a lot of pain, stiffness and restricted mobility because of frozen shoulder. Now, what are the treatment options available for the frozen shoulder? The first and primary treatment that has to be done for a patient with frozen shoulder is physiotherapy. Physiotherapy is mandatory. You have to get physiotherapy done so that the joint mobility may be restored and the person may become better. And painkillers also can be tried, and steroid injections can be tried, and in some cases surgery also can be performed. These are the treatment options available in allopathy for a patient suffering with frozen shoulder. If a person gets treated for the frozen shoulder with the painkillers, with the steroid injections or with physiotherapy, some patients recover very fast. In few weeks they will recover. Some people may recover in some months to years. Some people may not have complete recovery also. So what should we do? What more can we do to recover from the frozen shoulder? Some people try acupuncture and they have reported that they have become better. Some people have tried the chiropractic care and that also helped some people, and some people have tried some herbal medicines and they said they became better. And I, being a doctor in homeopathy also, I recommend using homeopathy along with allopathic medicines. Homeopathy also is a complete system of medicine, and it has wonderful medicines which can help the symptoms of frozen shoulder. If you want to use homeopathy, you can as well use homeopathy along with all the allopathic medicines, and over a period of time homeopathic medicines will help you to become much better. So if you or somebody is suffering with frozen shoulder, what best can we do to recover from frozen shoulder? So if somebody is suffering with frozen shoulder, whether you or your relatives or anybody known to you, what is the best approach to get rid of the frozen shoulder at the earliest? Number one, physiotherapy. Number two, using painkillers for a brief period of time as required. Number three, taking a steroid injection. Number four, surgery is an option. Number five, the other alternative systems of medicine can be tried, and homeopathy is one of the best systems which will relieve the symptoms and help the patients. There are many patients even with me who have got good relief with this integrative medicine approach using allopathy and homeopathy together. Hope this video has helped you, and if you have suffered with frozen shoulder, and if you want to share your story, or if you want to help people by telling other methods also whereby a person can become better, you can comment and let us know. Thank you.